Welcome to the No Limits podcast with Lisa Jakovsky. As an author, Lisa shares fellow authors whose work has a special message. Aspiring writers find these conversations inspiring and helpful for their own upcoming or current journey. In addition, Lisa's experience helps families with children or adults with special needs, or anyone interested in autism or psychology in general. So, sit back, relax, and enjoy the No Limits podcast with Lisa Jakovsky.
Hello, and welcome to the No Limits podcast with Lisa Jakovsky. Today, I have with me Dr. Correia. How are you doing today, Doctor?
Hello, thank you for having me in your podcast. I'm doing well, thank you. How are you?
Awesome. I'm good. I am super excited because not only are you in the mental health field, you're an author, and you've been doing some amazing things.
Thank you. Yeah, that's correct.
I'm excited to get into it. Can you tell us about your degree and exactly what you do in the mental health field?
Definitely. So I do have a PhD in clinical and forensic psychology, and then I specialized in psychiatry. So at the moment, I work in complex mental health. So I work with patients diagnosed with complex mental health and forensic history as well.
That is so cool. Can you explain what complex mental health is? I've never heard that term before. I've worked psych though.
So basically, we have certain diagnoses that require more monitoring or dual diagnosis, such as schizophrenia and personality disorder, or schizophrenia combined with bipolar schizoaffective disorder. So, and then obviously that linked with different personalities leads to a very complex case. So we call complex mental health just because requires more input and a different treatment.
I like that. I've worked with different disorders like that before, and I just taught a class called Abnormal Psychology that was all about schizophrenia, bipolar, and I like the idea of calling it complex a lot more.
That's true, yes. But it's really, I think it becomes a bit more complex, especially when the patients have also forensic history. So there's, I don't know how it works in the United States, but here in the UK, obviously we have various laws, and we, people with mental health, they are really protected, and we have plenty of resources. So, our patients at some point in their lives, they have committed very serious crimes. Obviously when they were unwell, in a state of relapse. And obviously they would then stay in a psychiatric ward for recovery period. And once they are assessed as being well enough to return to the community, that will happen. And obviously they will have a team involved that will monitor behaviors, medication compliance, and they will then issue reports to the court to ensure the person is doing well outside in the community. So it's really complex. So the word says everything.
Yeah, I totally agree. And we're similar here, but I feel like, and it kind of just gives me the vibe that you guys do much better than we do here in the US because we have resources, but we don't make it known. And then it's very hard to get the training for the staff to help the individuals too. So it sounds like you guys do a really good job over there in the UK. I feel like the US, we have a lot to learn still.
I think even back home, obviously, I'm not from the UK originally, so I was living in between Portugal and Spain. So it's such a difference, even in terms of awareness. So, people don't talk about mental health. There's a stigma that if they talk about mental health, it's contagious. If we talk, it will happen. So we don't have much awareness or campaigns, or even, we don't have people actually fighting for the rights of those individuals, which is really sad.
Exactly.
But here you have this opportunity.
It's the exact same thing here. And that's why I started my podcast and started my books, because we need to break down that stigma. We need to get those resources out there, and I'm working on my doctorate in school psychology and learning about personality disorders. I was just like, whoa, there's a lot more than I thought there were. A lot more
Definitely.
than
And a
worked
diagnosis is just a diagnosis. Once you meet with the person, you will see, okay, this is, half of it, yes, I have studied, but the other half, whoa. So you'll be amazed every time you meet with people with certain diagnoses. Even today happens to me, like if I need to meet someone with a very complex diagnosis, and I will sit with the person, we'll have a one-to-one, and, at the end of it, I'll be like, wow, I'm so amazed. Or because, there was no empathy whatsoever, or because, the narcissistic traits are really so clear. So I get really amazed, and I come home, I do some notes. I like them to explore, because we don't know everything. And there are certain behaviors that you still, okay, let me explore a bit more about this. I was not expecting this. So it would also depend on each person's personality.
And that's what makes you such a good therapist, because there's a lot of therapists here in the US that don't take that extra time, that are kind of like, there's so much misdiagnosis over here. When I worked with adults the first 4 years in the field, I sent every client back for a re-diagnosis, and I was correct. They were all misdiagnosed. And it's so crazy to me. And I get that, like, it's hard. A lot of the diagnosis I've learned overlap, and it's very difficult to kind of pull them apart. And, like, our field is very demanding. But if you just take that extra time and they get on the right medication, the right treatment plan, then they wouldn't have to go back like that. So I love that you do that.
I do recall a patient, actually. He was in the community setting, and he was having this, there was a whole history. So he was arrested in the past. He served a sentence, and there was records of him being sexually abused while in prison, to the point that he decided to take his own life. And obviously that, didn't went really well. So he ended up having a serious brain injury, affecting his mobility as well. So this person, every day, he will make accusations against the staff or visitors that they were sexually assaulting him. And obviously, sometimes we don't have the time, but for this specific person, I wanted to dig further. I wanted to understand why he was having this sort of behavior. And I was reading the reports, and he had 2 years of psychology input. And I was reading about, he has this trauma, or, he just likes to cause issues, cause trouble, and he will make allegations. No one does that every day just for the sake of it. Especially because when I started, when I first met with him, the way he would describe those allegations, they were so vivid. It was impossible that they were just allegations. So he had two options: or it's happening, or he really believes it's happening. So there is something there. So obviously he did further assessments, and then he was diagnosed with PTSD, which then triggered false memories. So he was having states of psychosis. So he would wake up every day and he would leave the same episode he experienced in prison every single day. So anyway, so he was like, for 2 years he was like that, and until obviously he was then properly diagnosed, and he was then prescribed antipsychotics. And actually, I spoke with him 2 days ago over the phone. He's no longer my patient, but I spoke with him over the phone, and it was incredible. He could maintain a discussion, speak about other things, while in the past he would just talk about, do you think this is right? They are doing this to me. And the discussion will be just about that. So, someone took the time to actually oversee the case, read history, and actually understand that, there is something else here. But I do appreciate, unfortunately, mental health is increasing, and we don't have enough mental health practitioners to look after so many cases, you see. So unfortunately, that will result in people being misdiagnosed, not having the time or the resources, really.
Exactly. And it's something that's so sad because there's such a stigma around mental health, and there really doesn't need to be, because look at your client now. Now your client is able to have his life, able to reach his potential and be able to be social and have a conversation with somebody. Whereas for 2 years, he couldn't do that. He was in a psychosis. It's such an amazing example of why it's so important to take care of our mental health and to take care of these individuals. And, part of the problem too is the pay. The staff here in the US at least get paid nothing to work with these
Same here.
individuals, right? Like, it's so
Same here.
unfair.
And staff, obviously they end up looking for another job, so you will not have consistency. So, and the problem is that they will get, the patients will get too confident with a certain staff member. Then after 2 weeks, that person no longer works there. So the process initiates again. There are trust issues, so many other issues. But definitely, they have a very, very hard job. I mean, all healthcare assistants, but I think the support workers or healthcare assistants that work in mental health, it's really tough because, you are there for a few hours, part-time or full-time, supporting people that they really require that attention. And sometimes you will not hear the best things, that you want to hear when you go work. You will be, verbally assaulted, you will be abused as well, and you need to still do your job. And the pays, I think majority of the companies are paying minimal wage really here as well.
Yep. Same here. And that was always one of the biggest problems. And even just working in a school now, I worked in the SEL room to help out during the spring, and the staff were not trained. They were paid very little. And they were like, why are these kids cursing at me? I'm like, because they know they can get under your skin. And I'm sitting there trying to tell them, like, hey, I understand where you're coming from. I know it's hard to not, let the verbal abuse get under your skin, but this is the reality of what you're working with. And these staff have no idea that's where they're being put. And it's just so sad. It really is, because we could do so much better.
Definitely. But I think because we have also plenty of providers opening new businesses for the wrong reasons. Right?
Oh, yes.
That people just, they're okay with that. They are okay with that because the money's going to someone else, isn't it? In the sense that here especially, I don't know how you guys call it there, but we have supported accommodations. We call it supported living accommodation. So when they are well enough to be discharged from the hospital, from the psychiatric ward, they will be in the community, but they will be still monitored with medication. They will have support with appointments. So they have designated places or homes for that purpose. So we have plenty of providers offering the same services. And you often find that the staff, they are not trained properly, or they do a set of mandatory online trainings every year. They're not trained enough. They're not paid enough. They do a huge amount of hours. They don't have a proper rest. They don't look after their own mental health. So it's really difficult to then support people diagnosed with complex mental health. But, unfortunately, people are becoming more greedy, and they are setting up those businesses with a different purpose. So they would just accept anything that it's, in terms of payment. So here, the funding can be partially paid by local authority, or the placement can be funded by other health authorities, but majority is local authorities, so they pay the care packages. And usually, some providers, they will just accept whatever the local authorities are willing to pay, even knowing that that person requires more, but they just prefer to, okay, let me keep this person, and at least there's some income coming, even if it's not a lot, and I'll pay less to the staff. So unfortunately, they don't open the businesses with the right reasons.
It's the exact same thing here. It's part of why I left working with adults, because I'll never forget, somebody on the board went up to my supervisor and was like, look at how much she makes us, we'll make it work. And this girl was not even appropriate. She was in the hospital and they were hands off, and she was learning if she does X, Y, Z, she can get out of whatever she wants. And then they want to put her in a social community setting. And I left before we even got her in, and I know it didn't go very well because my old supervisor had reached out to me like 6 months later, but it's just, it stuck with me. And I think it's incredibly sad that they're going based on the money because, like you said, we are getting more mental health, an increase in it, and they're human beings. They deserve to be treated, like human beings. And I feel like they're not half the time.
Definitely. And having this empathy, we never know what can happen, right?
Exactly.
And giving that example of that individual that he had a brain injury, while he was in prison prior to his injury, he was not diagnosed with any mental health at all.
Oh my God.
So he had 2 kids, a wife, and he ended up committing a crime, and then he was arrested. So he was serving 4 years. And obviously he was sexually assaulted, he couldn't handle it, and he decided to take his own life. And obviously then the brain injury and all of that, triggered other conditions. But he never had mental health. He had a normal life. He had a wife, children, he will go home, he will pay his rent. So it can happen to any of us. And I don't think people understand that. It's like sometimes when I have this, I see a situation where people have this lack of empathy towards people using a wheelchair, for example. And I'm like, wow, car accidents happen every day. Things happen every day. How would you like to be treated, you see? So it's really, really, really sad.
I agree. People don't realize until it does happen to them because that's a break in their brain that got triggered by the trauma when he was in prison. And like you said, accidents can happen every day and people just don't realize. You also wrote an award-winning book called Complex Mental Health Benefits of Social Prescribing. Can you tell us about that?
Yes. So obviously I've decided to open my new company this year.
That's great. Congrats.
Thank you. For the right reasons, obviously. So we are actually the only company that offers the whole service.
That's amazing.
Yes. So obviously the main foundation is social prescribing, just because we see a lot people going to GPs and to the hospital, or when they're admitted, they have plenty of medication that is prescribed, but the main issue is there and it's not being addressed. You see, like people that they have very dysfunctional families, so there is no work being done with the families trying to recover whatever can be recovered, or do whatever can be done to build the family again, because that will be the main support for that individual, or activities, or healthy eating, or just socializing. Nothing like that is promoted, unfortunately. So we have medication which is promoted a lot, isn't it? So you go to a GP, have a headache, and they prescribe paracetamol or Benadryl or ibuprofen, but they don't tell you, okay, you know what? Go and have a coffee with your friends. After the coffee, give me a call and tell me if you feel better. So those things make the difference. So obviously the type of setup I have, or it's we have private GP, we have physiotherapists, occupational therapists. So we have a team that's available in case of crisis as well. So we have a hotline. So we have always someone experienced with mental health available 24 hours in case an individual enters in a crisis. So it's some sort of supported accommodation, but we have the whole service available. Now, obviously, we know that the funding, it's not, it's not possible to pay all of that with funding. But I do believe that, I don't want to do this for money. It's for the good reasons. So I will have other types of rewards. But that's the setup I have at the moment. Just because, obviously, going back to the book, I felt that we didn't have enough awareness. We have plenty of campaigns in the UK. We do have plenty of charities, but we don't have people actually going the extra mile and saying, you know what, let's stop this nonsense. Let's talk about it. Let's find a solution, etc. So I thought it would be a good idea to just write a bit more about complex mental health. I think people don't have much understanding on the terminology. So, and also give an overview of the struggles that people
I agree
go
completely.
through. Yeah. And for families as well, professionals, but also we'll give some guidance for patients, families, individuals that they don't have an idea of where to start, or they are suffering with mental health and they are scared, or they feel embarrassed. So I think this book, it's kind of empowerment. Okay, it's not an issue, can be solved. You have the resources available. Just do it. And that was the main reason. It was my first book, so I don't see myself as a writer, to be honest. And I wrote this book just based on my experience as a professional and people I've met throughout my journey. But I hope that will be useful for people that really need it, really.
It absolutely is. I've got it on Amazon and read parts of it, and I think it's amazing. I think it's so helpful and so needed, because you're right, they over-medicate, and part of that is money for insurance companies. The more they make insurance companies, the more the doctors make. But people don't realize how important family therapy is. I just got a job as an assistant psychologist, and the clinic is very similar. It's like what you started is what I want down the road too, in a clinic like this in California. And they have like education therapists and, pivotal response training and family therapy. And it's so important to have that. And people don't realize, and they don't even know what it is. I've gotten so many questions about what all of that is. And that's why we need books like yours. And that's why it's amazing. And I love that it won the award and everything, because we need more resources like that. That's incredible. What advice would you have for someone who is struggling with mental health issues?
I think it's really important to understand that it's normal. At some point in our lives, we all struggle with mental health, and COVID was a good example. Maybe not complex mental health, maybe, some sort of mental health that doesn't require this much input, but at some point in our lives, we all struggle. If we lose a family member, if we are struggling financially, we all have some stages in our life where we need that extra support. And my advice is, it's okay to ask for help. It's okay before things escalate, and then again, you will need to get into a system where you will only be prescribed medication. You'll be in this system where you'll be seen maybe once every 6 months or once a year by a professional that will never get to know you well. You will need to be on a waiting list to see a psychologist or to go through therapy for 1 year minimum. So ask for help. There are plenty of resources available before things escalate. And again, this is when social prescribing, it's really important, because there are things you can do to improve your mental health before going to a doctor and being prescribed a cocktail of medication.
I agree completely. And I think that's amazing advice, because we really need to break down the stigma. It's so hard for people to admit they have that issue, and then they just don't know where to look, and it becomes so much more down the road. And I think that's amazing advice, just so people know that it's okay, and hopefully one day we don't have this stigma anymore. What is your favorite thing about being in this field?
I would say definitely help others. I think it feels good when you actually do a recovery treatment plan, and you support the person to set up clear goals, and you help the whole team to help the person to achieve those goals and to prevent a relapse, really. So I think that's the most rewarding thing about working in mental health, to be very honest. And, seeing people doing things that they never done before, something I have introduced as well in those settings, and they did not exist as much, is activities. So I'm really obsessed with activities. So I would call the teams on a daily basis. Okay, what activity do you have planned for today? What is this person doing? Because I do believe that if you keep, you keep them engaged, you keep them happy, that will give us good outcomes. You'll not feel too bored. You will not feel so suicidal. You have a network, you have people that care for you. And that's what I want them to feel. So activities, definitely. So, and various activities. So again, the mindset, because at the beginning, when I first came to the UK, I would hear from my supervisors things like, oh, this person, he doesn't do anything. Look at the history. He doesn't do any activities. He was part of a gang, and etc. And I was like, okay. And I would then start slowly gaining the trust and trying to do small things, just going with the person, I'm going to the shop. Do you want to come with me? Just few things. And, that person ended up baking a cake with other residents. And I was really proud taking pictures and showing, you see, it's possible. It's possible, and they really enjoyed it, and they ate the cake. Actually, we found that activities that involve cooking are so attractive because they like, not just the preparation, but then they like to stay and eat and engage. So, it's a very good activity. So, this shows that people don't have the understanding and the knowledge around mental health yet. And I think they do believe that, yes, that person has mental health, he's fine, provided he's taking the medication, he's fine. And, they're just forgotten, just there. And it's really, it's not acceptable. So yes, activities, definitely, I would recommend any provider to include daily activities, group activities, even just art therapy as well, or even if you don't have many resources, just like you used to do in school, bring them all, sit on the table, ask them to make a painting or to draw something about how they feel. I used to have a positive box that I created, and every time one of the patients would like to come to the office to engage with the staff, they would need to write a positive thought with no name, and they will put it inside that box. And then at the end of the month, we will all get together and we will read the positive thoughts. And that was a very, very nice activity. There are plenty of activities that can be done.
I love that.
Yeah, but that, was so good, because then they would like, oh, I'm sure this is the one that wrote this. Oh, you wrote that. And they will have such a good time. And you would think that, some people, they were so negative on a day-to-day basis. They had severe depression, very suicidal, and actually you couldn't find any note that was very negative. So it was possible. So at some point that person can actually think positively. So we just need to do something about it. So yeah, this was one of the activities we used to do as well. But there are plenty of things, as I said, just investing your time, train your team, and make sure things are happening.
I love that. I love that idea of that activity. I'm definitely going to bring that to the school this week and let the social worker know in case we do SEL groups.
Oh, that would be brilliant.
Like they would love that. I helped out with her and the school psychologist in the spring, and the kids would love that. I think that's a great idea. It's something little like that that you don't realize the impact. And that's what a lot of people don't know. And that's why I think it's amazing you have your practice and you have your book. Where can people buy your book and contact you if they have questions?
So my book is available on Amazon and can be sent to any country. Only in English at the moment. I have been asked for translations, but I have been really busy. I haven't looked into that yet. So at the moment, available only in English, but can be dispatched to any place in the world. How people can find me, and I'm on LinkedIn, I'm on Instagram as well. and not easy to find.
What else is next for you?
So at the moment, I'm planning to set up a charity. Yeah, so more focused on obviously human rights, mental health as well, sex trafficking. But I would like to involve the residents I support, the clients I support, to take part of it, to make part of it, because I know how difficult it is for them to find a job as well because of their criminal records. So this charity will give them the opportunity to also have a job. And again, will be an activity, will be something they will be doing and engaging and meeting other people without being scared, you know.
Yeah.
So that's my new project. I'm exploring things at the moment, but that's my next plan really. So hopefully it will be helping people, not just from the UK, but from other countries as well, and reach out for more people, yes. And employ more people with that unfortunately cannot have a job due to their criminal records, mental health, etc. So yes, that's the plan.
That's amazing. You have to keep me posted. See if I can help at all, if I can spread the word. I think you're doing wonderful things, and I'm so excited to see how it all goes. Thank you so much for being here and for everything that you're doing.
Thank you so much for having me. I'll keep you posted. And congratulations as well. I read your profile, your books, and it's really amazing. I think we should make use of our time. So I think you're doing an amazing job.
So that means so much. I appreciate that. We're definitely going to talk more and see how I can help out more.
100%. Thank you so much. Thank you. Bye.
Dr. Correia.
Bye. Thank you.
This is the No Limits podcast with Lisa Jakowski. Thank you so much for listening. And if you'd like to come on, please check out my website. Thanks.